Start by understanding what immunodeficiency means. Our immune system is like a shield, protecting us from harmful invaders such as bacteria, viruses, and fungi. When the system doesn't work properly, it's called immunodeficiency. Severe immunodeficiency is a condition where the immune system is extremely weak or almost absent, making it difficult for the body to fight off infections. This can lead to frequent, severe, or unusual infections that are hard to treat. Recognizing the basics of this condition is the first step in understanding its impact on health and daily life. Immunodeficiency can be divided into two main types, primary and secondary. Primary immunodeficiency is usually inherited and present from birth, while secondary immunodeficiency develops later in life due to external factors like infections, medications, or other diseases. Severe immunodeficiency often refers to primary forms such as severe combined immunodeficiency (SCID), but can also result from secondary causes. Understanding these types helps doctors determine the best approach for diagnosis and treatment. Severe combined immunodeficiency, or SCID, is one of the most serious forms of primary immunodeficiency. In SCID, both major parts of the immune system, T cells and B cells, are affected. This means the body has almost no defense against infections. Babies with SCID often appear healthy at birth but quickly develop life-threatening infections. Early diagnosis and treatment are crucial for survival, making awareness of SCID especially important for parents and healthcare providers. Severe immunodeficiency can have several causes. In primary forms like SCID, genetic mutations are often responsible. These mutations are usually inherited from one or both parents. In secondary forms, factors such as HIV infection, certain cancers, or treatments like chemotherapy can damage the immune system. Sometimes malnutrition or other chronic illnesses can also weaken immunity. Identifying the cause is essential for choosing the right treatment and improving outcome. Genetics play a significant role in many severe immunodeficiencies. In conditions like SCID, specific gene mutations disrupt the development or function of immune cells. These mutations can be passed down through families, often in an autosomal recessive or X-linked pattern. Genetic testing can help identify these mutations, allowing for early diagnosis and family counseling. Understanding the genetic basis is key to developing targeted therapies and preventive strategy. Secondary immunodeficiencies are caused by external factors that damage the immune system. HIV infection is a well-known example, as the virus attacks and destroys key immune cells. Other causes include certain cancers, especially those affecting the blood or lymphatic system, and treatments like chemotherapy or radiation. Even prolonged malnutrition or chronic diseases can lead to secondary immunodeficiency. Recognizing these causes helps guide appropriate medical care and prevention. Understand severe immunodeficiency. It helps to know how the immune system normally works. The immune system is made up of various cells and organs that work together to detect and destroy harmful invaders. White blood cells, such as T cells and B cells, play a central role. When these cells are missing or don't function properly, the body becomes vulnerable to infections. This is why immunodeficiency can have such serious consequences. T cells and B cells are the main soldiers of the immune system. T cells help coordinate the immune response and directly attack infected cells, while B cells produce antibodies that target invaders. In severe immunodeficiency, both types of cells may be absent or dysfunctional, leaving the body defenseless. This explains why infections can become frequent, severe, and even life-threatening in affected individuals. People with severe immunodeficiency often experience a range of symptoms. These can include frequent infections, slow recovery from illness, and infections that are unusually severe or caused by uncommon organisms. Other signs may be poor growth in children, chronic diarrhea, or persistent skin rashes. Recognizing these symptoms early can lead to faster diagnosis and better management of the condition. Infections are the most common and dangerous problem for people with severe immunodeficiency. These infections can affect any part of the body, including the lungs, skin, digestive tract, and bloodstream. They may be caused by bacteria, viruses, fungi, or even organisms that rarely cause illness in healthy people. Because the immune system is so weak, these infections can quickly become life-threatening if not treated promptly. One hallmark of severe immunodeficiency is the occurrence of unusual infections. These are infections that rarely affect healthy people but can be devastating for those with weakened immunity. For example, certain types of pneumonia, fungal infections, or viral illnesses may be much more severe or persistent. Doctors often look for these unusual infections as a clue to underlying immune problems. Children with severe immunodeficiency may struggle to grow and develop normally. Frequent infections can interfere with nutrition and energy, leading to poor weight gain and delayed milestones. Chronic illness can also affect learning and social development. Early diagnosis and treatment are important to help children reach their full potential and improve their quality of life. Digestive issues are common in people with severe immunodeficiency. Chronic diarrhea, poor absorption of nutrients, and frequent stomach infections can all occur. These problems can lead to dehydration, malnutrition, and further weaken the immune system. Managing digestive symptoms is an important part of overall care for affected individuals. Skin problems can be an early sign of severe immunodeficiency. Persistent rashes, eczema, or unusual skin infections may appear. Sometimes, wounds heal slowly or become easily infected. Paying attention to skin changes can help with early detection and prompt treatment of underlying immune issues. Diagnosing severe immunodeficiency involves a combination of medical history, physical examination, and laboratory tests. Doctors look for patterns of frequent or unusual infections, poor growth, and family history of immune problems. Blood tests can measure the number and function of immune cells, while genetic testing can identify specific mutations. Early and accurate diagnosis is essential for effective treatment. Laboratory tests play a crucial role in diagnosing severe immunodeficiency. These tests can include complete blood counts, measurement of immunoglobulin levels, and analysis of T and B cell function. Sometimes, doctors may also test for specific infections or genetic mutations. Accurate lab results guide treatment decisions and help monitor progress over time. Genetic testing is especially important for primary immunodeficiencies like SCID. By analyzing a person's DNA, doctors can identify mutations responsible for the condition. This information can help with family planning, early diagnosis in siblings, and choosing the most effective treatments. Genetic counseling is often recommended for families affected by severe immunodeficiency. Some countries, newborn screening programs test for severe immunodeficiency soon after birth. Early detection allows for prompt treatment, which can be life-saving. These tests usually involve a simple blood sample and can identify babies at risk before they develop serious infections. Expanding newborn screening is an important step in reducing the impact of severe immunodeficiency. Treating severe immunodeficiency requires a comprehensive approach. The main goals are to prevent infections, treat existing infections quickly, and restore immune function if possible. Treatment plans are tailored to each person's needs and may involve medications, lifestyle changes, and sometimes advanced therapies like stem cell transplantation. Ongoing medical care is essential for managing this complex condition. Prevention is a key part of managing severe immunodeficiency. This includes avoiding contact with sick people, practicing good hygiene, and sometimes taking preventive antibiotics or antifungal medications. Vaccinations may be recommended for family members and close contacts, but some vaccines are not safe for people with severe immunodeficiency. Careful planning helps reduce the risk of dangerous infection. When infections do occur, prompt and aggressive treatment is necessary. This may involve antibiotics, antiviral, or antifungal medications, often given through a vein in the hospital. Doctors may also use immune globulin therapy to provide extra antibodies. Quick action can mean the difference between recovery and serious complications. Immune globulin therapy is a common treatment for severe immunodeficiency. This therapy involves regular infusions of antibodies collected from healthy donors. These antibodies help protect against infections and can be given through a vein or under the skin. Immune globulin therapy is often a lifelong treatment for people with severe immunodeficiency. For some people, especially those with SCID, stem cell transplantation offers the possibility of a cure. This procedure replaces the faulty immune system with healthy cells from a donor. The process is complex and requires careful matching and preparation, but it can restore normal immune function. Early transplantation, ideally before serious infections occur, offers the best chance of success. Gene therapy is an exciting new approach for treating certain severe immunodeficiencies. Scientists use specially designed viruses to deliver healthy copies of the faulty gene into the patient's cells. Early results are promising, and some children with SCID have been cured using gene therapy. Research is ongoing, and this treatment may become more widely available in the future. Supportive care is essential for people with severe immunodeficiency. This includes regular medical checkups, nutritional support, and sometimes physical or occupational therapy. Emotional support for patients and families is also important, as living with a chronic illness can be challenging. A team approach helps address all aspects of health and well-being. Living with severe immunodeficiency requires ongoing attention to health and safety. Patients and families must be vigilant about infection risks, follow treatment plans closely, and maintain regular contact with healthcare providers. With proper care, many people with severe immunodeficiency can lead active, fulfilling lives, although some limitations may remain. Severe immunodeficiency affects not only the individual but also their family and social circle. Parents may face stress and anxiety about their child's health, and siblings may need extra support. Social activities may need to be adjusted to reduce infection risks. Open communication and support networks can help families cope with these challenges. Raising awareness about severe immunodeficiency is crucial for early diagnosis and better outcomes. Education programs for healthcare providers, teachers, and the public can help identify at-risk individuals and reduce stigma. Increased awareness also supports research and funding for new treatments. Vaccines are an important tool for preventing infections, but not all vaccines are safe for people with severe immunodeficiency. Live vaccines, such as those for measles or chickenpox, can be dangerous. Doctors will recommend a safe vaccination schedule for patients and their close contacts to help protect against preventable diseases. Good nutrition is vital for supporting the immune system. People with severe immunodeficiency may need special diets or supplements to ensure they get enough calories, protein, and vitamins. Working with a nutritionist can help manage digestive problems and prevent malnutrition, which can further weaken immunity. Physical activity is important for overall health, even for people with severe immunodeficiency. Gentle exercise such as walking or stretching can help maintain strength and energy. However, activities should be chosen carefully to avoid exposure to germs or injury. Consulting with healthcare providers ensures a safe and enjoyable exercise routine. Living with a chronic illness like severe immunodeficiency can take a toll on mental health. Anxiety, depression, and stress are common, especially in children and their families. Access to counseling, support groups, and mental health professionals can make a big difference in coping with the challenges of this condition. Children with severe immunodeficiency may face challenges at school, such as frequent absences or the need for special accommodations. Schools can support these students by providing flexible learning options and maintaining a clean, safe environment. Communication between families, teachers, and healthcare providers is key to ensuring educational success. As children with severe immunodeficiency grow older, they face new challenges in transitioning to adult care. This includes learning to manage their own health, making decisions about education and work, and planning for the future. Support from healthcare teams and family members helps make this transition as smooth as possible. Ongoing research is leading to new discoveries and better treatments for severe immunodeficiency. Advances in genetics, stem cell therapy, and gene editing hold promise for the future. Clinical trials are testing new medications and therapies, giving hope to patients and families affected by this condition. Patient advocacy groups play a vital role in supporting people with severe immunodeficiency. These organizations provide information, connect families, and advocate for better access to care and research funding. Getting involved with advocacy groups can help patients and families feel less alone and more empowered. Managing severe immunodeficiency can be expensive, with costs for medications, hospital visits, and specialized care. Insurance coverage, government programs, and patient assistance funds can help ease the financial burden. Social workers and patient advocates can guide families through the process of finding resources and support. Traveling with severe immunodeficiency requires careful planning. Patients may need to bring medications, avoid crowded places, and ensure access to medical care at their destination. Consulting with healthcare providers before travel helps ensure a safe and enjoyable trip. Emergencies can happen at any time, so it's important for people with severe immunodeficiency to be prepared. This includes having a list of medications, emergency contacts, and a plan for accessing medical care quickly. Families should also know when to seek immediate help for symptoms like high fever or difficulty breathing. The long-term outlook for people with severe immunodeficiency has improved dramatically thanks to advances in diagnosis and treatment. With early intervention and ongoing care, many patients can live longer, healthier lives. Continued research and support are essential for further progress. There is hope for people with severe immunodeficiency. New treatments, better understanding of genetics, and supportive care are making a real difference. Families and patients can look forward to brighter futures as science continues to advance. Staying informed and connected to resources is key to navigating this journey. Severe immunodeficiency is a serious but manageable condition. Early diagnosis, personalized treatment, and ongoing support are essential for the best outcomes. Advances in medicine are offering new hope, and families are not alone in facing these challenges. With the right care, many people with severe immunodeficiency can lead healthy, fulfilling lives. Many resources are available for families affected by severe immunodeficiency. Hospitals, advocacy groups, and online communities offer information, support, and connections to others facing similar challenges. Reaching out for help can provide comfort and practical advice for managing daily life. Medical knowledge is always evolving, so staying informed is important for patients and families. Regular check-ins with healthcare providers, reading trusted sources, and participating in support groups can help keep everyone up to date on the latest advances and recommendations. Severe immunodeficiency presents many challenges, but with early diagnosis, effective treatment, and strong support, individuals and families can thrive. Advances in science and medicine continue to improve outcomes, and hope is on the horizon. Remember, you are not alone. Help and resources are available every step of the way.